So for our primary outcome was looking at those who were maintained on their convenience regimen once readmitted during OPAT, and we found about a quarter were. So a quarter when they came in were either continued on daptomycin, which is a formulary agent for us, or meropenem. For our study, ertapenem isn't on formulary. It's usually just given outpatient. So we looked at patients who had come in and were restarted on meropenem when maybe they had been on a more narrow spectrum agent before. With our study, we did look at rates of C. diff and as well as cost. With C. diff, we saw more C. diff in the daptomycin group than the ertapenem group, and it was relatively low. It was 9% versus 6% for each agent. And that was relatively unexpected because you wouldn't necessarily expect daptomycin to cause C. diff infection since it has activity. However, looking back on that, it was the same patient readmitted multiple times and having positive tests. We also weren't able to evaluate for the purposes of this study whether or not the positive PCRs were representative of true infections. In all of the readmissions, there was about a 12% adverse event rate, and we saw more adverse events in total with daptomycin than ertapenem, but it was relatively expected. The most common adverse event with daptomycin was elevated CPK, and the most common adverse events to ertapenem were things like drug-induced seizure or drug-induced fever.